All right, everyone, is interview time, and we are here with Paul Gittens. But oh my god, it's like oh my god, this is like kittens.
Dr. Paul Gittens.
I know, doctor. I know I was gonna say MD, but I do the kittens, and so I have a thing with the T's. Oh god, kittens, gittens. How
Well,
would
we
you
should
say it?
ask him how he says it because he has two T's
Okay,
in his last name.
first I want to hear how you would say.
I would say Dr. Paul Gittens.
Oh, I
How would you-
like it. You know, what I always say is it's kittens with a G. So you guys got it right.
So,
Yeah.
but I think I do my kittens with like a D instead of the T's. Like,
Yeah.
like
Oh, you do kittens?
kittens. I don't know. It's a thing.
Oh,
Yeah.
okay.
Gittens.
You got to say that T. You got to say
Yeah.
it with purpose. Gittens.
Dr. Paul Gittens.
There you go. With purpose. With
Yes.
purpose.
With purpose. I love it. Thank you for that educational moment. And I need that. And also, we're here to talk about Scrotox.
And ED.
ED, yes. And all things erections, and which is really
And
fun.
sex after some kind of cancer
Mm-hmm.
too,
This
like
will-
prostate or bladder cancer. So stay tuned because this is going to be a great episode.
And we talked about Scrotox in the past. When we did that, it was more like for a vanity thing. So I'm very curious to hear more about that. But without further ado, you all heard us in the intro giving a little bit of information about Dr. Paul Gittens. And did it, nailed it.
I love it.
Yes, thank you. Thank you for that. I feel special. But Dr. Paul Gittens, Dr. Gittens, still makes me nervous when I say that.
Aw.
Can you please tell us a little bit more about how you got to where you are today in the field of sexuality?
Yes. So I am a board certified urologist. So I spent a lot of time in the field of urology in terms of prostate cancer and BPH and male infertility. And then from there, with just having a lot of patient experiences, I went in the direction of sexual medicine. And so for sexual medicine, after your 6 years of urology training, you do an extra fellowship. So it's extra specialty training in sexual medicine, which I did out in Houston in Texas. And I learned a lot about sexual dysfunction. I learned everything about microsurgery and male infertility, as well as female sexual dysfunction. So that's kind of the short answer. But what really led me to this field was the fact is when I was a resident and, it's just taking care of patients. And I just felt like no one really talked about sexual dysfunction. Nobody talked about sex. Nobody talked about infertility for men. And so I thought it was a great field to go into because I love talking about these things. And I like treating men and women that have these difficulties. And, it's blossomed from there, and I love, it's a bless. I mean, I'm just so happy to be able to work with these individuals.
Oh, yes. And we're happy to have you here talking to our listeners because ED is not only a hot topic, it's a subject that it gets a little bit of stigma sometimes. Folks that have penises, they can get really triggered by talking about their penis performance. They can get triggered talking about the size or like what are the causes, right, of what's happening with ED. And I know that you have so much background and you are such a respected not only doctor but person that's researched and had a lot of impact on a lot of folks out there and their lives. So can we get to the bottom of ED first and foremost? So let's talk about what ED is. If there's anyone listening that's like, what is ED? We should just talk about that in the most basic level. And then what are the main causes and who does this affect? Meaning the percentages of folks, the penis owners out there and the age range. Is it something that people are not experiencing now, but they could experience later? Can you please talk more about ED?
All right. That's a mouthful. So you might have to remind me as I'm going through this. All right, just give me some cues. But the first, basic answer is what is ED? So ED is the inability. I'm going to give you the proper definition. It's the inability for a person to either initiate or maintain their erection as satisfactory for sex. And sex has the definition of sex varies, right? So this person could be having penetrative sex. They could be having masturbation. They could be looking at whatever it is, right? It's the inability to be able to initiate and maintain that erection. And they come in a lot of different varieties. There's some guys that can start and then they kind of fade as they're having intercourse, right? There's some guys that kind of have a stuttering start where they start and then they kind of fade and they start and they fade. So it's a varying degree, but essentially it's initiation and maintenance of the erection. The causes, that was another question, right? So
Yes,
causes,
nailing it.
they vary, So we know the number one cause why guys have erectile difficulties is really age, right? So as guys get older, they're more likely to have ED. So in some of the percentages are, a guy that's 40 years old, they probably have a 40% chance of having erection problems. I saw a guy in my office today. He actually lived in a nursing home and he was 85 years old and he had just suffered erectile dysfunction like 2 or 3 years ago. So he's pretty fortunate, right?
Wow.
And he's having some ED issues. And he says, listen, there's a lot of women here in the nursing home that want me, right? So I want to be able to.
It's a hot spot for a lot of casual sex.
It is a hot spot. I'm telling you.
Hence why it's one of the places where there's a lot more STIs floating around.
You better believe it.
Yeah.
You better, because it's that one guy and he's sleeping with about 10 women.
He's like, I got this. Please help my cock.
That's right. That's right. So it affects all ages, but it's more likely to affect you if you're older, right? But not necessarily. Like I said, this guy who's older and he just started having ED last year. But other causes, there's some vascular causes. So guys that have high blood pressure or diabetes, they're more likely to have some issues. There's hormones. So we always talk about testosterone and estrogen imbalance and all these things, and thyroid disease that can also cause some issues. There are like physical things that can happen to the penis, right? So some guys have something called Peyronie's disease where they have like a plaque or a scarring of their penis, which can kind of restrict the flow, right? There's other issues where it could be more anxiety driven and psychological. So that can also cause some ED. And then there's medications, right? There's medications that we know that we take, right? Either for blood pressure or maybe for depression, for anxiety, that can also cause some ED. So, when we're looking at an individual and we're working them up for erectile dysfunction or erectile difficulties, which I like to say, right? Because dysfunction, I hate that word. I like to say difficulties, right?
Agreed.
Yeah.
Right. And so we look at all those things and we try to figure out what's going on with them. And then we try to fix them, and the best way we can.
And so that brings us to our next question of like the how to, right? Like what are the common treatments and exercises that are available for folks with blood flow issues that could cause erectile difficulty? And I'm curious if we, like, this is just my wild Amy side. So if we could look at like someone in their 30s, 40s, and then like, let's go to the 80-year-old guy that came in and he's like, so the last 3 years, the rest of the years were great. Like what are the options for all of these different age groups or people?
Yeah, so it's really not about age. It's about their function, right? Because a 70-year-old guy, if he's lucky, he could have great erections. And then you can have a 40-year-old guy that has even worse erections than that guy. So what we're doing is we have to do a really good evaluation. So if it's hormones, we're fixing them with hormones. But I personally like to do ultrasounds of the penis. And we do that with a small little injection. And with that small injection, I'm able to see, all right, what's going on with the vasculature of the penis. And so we kind of break those things down into not getting enough blood flow into the penis, or is blood flow going in and then it's slowly kind of leaking out, right? So those are the kind of things that we're looking for. We're also looking for some neurological issues. So, we do nerve testing. And then after we get that information and we look at labs and everything like that, physical exam, blah, 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 we say, all right, what are we going to do for treatment, right? And, treatment regimens, they go in a number of different kind of levels. For guys that want to try to be proactive about their penises, then we may say, all right, let's use something like the exerciser, which is like a hydro pump that we use to start exercising the penis and start trying to get more circulation into the penis. For other guys, we may say, all right, so some guys say, listen, like, I don't really want to go on Viagra. I know that I'm probably at that stage. Then we might use something like the exerciser, but then we might try to get increased blood flow to the penis, and we'll use something like core wave therapy, which is like low intensity focused shock wave therapy, right? Which increases and stimulates the penis to get better blood flow there. So we can use that in combination, right? For guys that are being proactive. For other guys that say they've tried Viagra or Cialis and maybe it's not working, then we can try to restore the penis, right? So we can use something like core wave therapy again. We'll use like the hydro pump again, something like the exerciser. And then we may use like PRP, which is platelet plasma. We may use Botox for the penis. I know you talked about Botox for the
That's
for
our
the
next
scrotum
question.
and
I can't wait.
Scrotox.
Yes, yes.
Hold on, but you're not talking about Botox for the penis too. So we got to, when you just place it in the scrotum, then the penis gets jealous. So we have to make sure that we put it in the penis too, right?
You can't forget about the penis. Aw.
Right? You can't forget about the penis.
Aw.
And so we'll use that for erectile difficulties as well.
Really?
Yeah. So it's off label. So all those, on PRP, core wave, Botox for the penis, scrotum, all those things are off label, but we use them because it makes sense, right? Because when guys are getting erection, it's actually a relaxation event, right? So what happens is the penis actually relaxes as it grows, right? And it allows for more blood flow to get into the penis, right? And so what's a really good muscle relaxer, right? Is Botox, right? And so Botox helps the penis relax, right? And it allows for a better erection. It's off label, not FDA approved, but
but are they like rock hard for like 3 months?
No, they're not. No, they're not. They're not, but they will hang a little bit more. So, the guys that maybe are in the gym and feel a little insecure, they can kind of walk around without their towel for a little
They're
bit.
showers now.
So they could do that. So those are some of and there's a lot of other things we do, but those are some of the things that we use to try to stimulate the penis, to try to rehab the penis, to get guys better erections. And then, there's other treatments. There's like injections for more severe ED. There's like a penile implant. There's, a number of other things that we can do to kind of help guys along depending on their stage, right? So if they're more severe versus if they're mild, it just depends on, what their status is when they're coming into the office and seeing me.
Okay. This is so good. And so off label, just to recap, in case anyone's wondering, that means not FDA approved.
Yep.
There are things like supplements. Like, I'm giving like an example. Like when
all my supplements say that.
Yes. So that's something that FDA hasn't looked at. But is that
yeah. So it's
accurate?
like it's using so Botox is FDA approved for the face, right?
Mm-hmm.
But it's not, if you put it in the penis, it's not FDA approved. So it's not approved for that. So all the studies haven't been done for Botox.
Okay, got it.
On the studies.
So the other thing that I want to say, so I used to donate plasma in college. So when I did, platelet-rich plasma, the therapy, does that mean some dudes might have gotten my plasma injected into their cocks? Because I'm like, yes. I mean, this was a long time ago. This is like 2002. But still, I'm like so stoked on this.
I hope
well,
so.
Only
I
if they're
hope so
lucky.
too.
Only
You're
if they're lucky. Only if they're lucky. No. But for PRP, we draw it from their own veins and we process it. But if they're lucky, then maybe you have some of your plasma floating around. They can throw that in their penis.
So.
Who knows?
You're welcome. I made like $20 like for like a pint. I was there for like 2 hours. I was like, this is really hard.
April's really hoping that her own plasma is rolling around your dick.
That was like the one thing I did from like my beer drinking money, Anyway, I just
in your erection, she sees, she's like, is that my platelets?
I know, you're welcome. Those are my platelets. That erections. Okay.
So my plasma.
Thank you for entertaining this, Dr. Gittens. He's like, okay, these two. Okay. So Scrotox. So you touched on the fact that Scrotox is specific to, I'm assuming the testicles, the scrotum, and then there's also in the cock, you can get cocktox. Do you call it cocktox?
Yeah, you can call it C-tox, C-tox if you want. Yeah, some people call it C-tox. Why not? C, right?
I go for detox, but never mind.
Yeah, that's the thing. You can't use detox. You got to use detox.
I take it back.
C-tox.
I retract.
I got some detox this weekend. So it's Botox. And it's off label.
So Scrotox. Yeah. So Scrotox is so the testicles are the kind of the balls inside the scrotum, right? So the Botox or whatever you're using, I mean, we say Botox, but it, obviously there's Dysport and all these other things. We just use Botox because that's what most people know Botox is. But you can place that on the skin of the scrotum, which helps to relax the scrotum. So for some guys, that bunch up a little bit, they can kind of have more of a looser scrotum and they just feel better. I also have some guys that have testicular pain. They walk around with a chronic testicular pain. And so on treating some of that testicular pain, when their scrotum kind of scrunches up or kind of wrinkles up, then it causes them more pain. So we can use it for that too. So there's a number of like medical as well as aesthetic reasons off label we can use the Botox for.
So when the penis is getting erect, usually you see the balls, at least from my experience, they kind of go up into, right, the penis.
Perineum?
Like the junction.
Well,
like
the
junction of the penis. Yeah.
Yes. So is that something that if that's relaxed, is that sometimes I honestly am so curious about this. So does that Scrotox kind of relax that? So sometimes the
make them hang lower or higher?
yeah, I like,
Yeah, so they'll hang lower. They will hang
Okay.
lower.
and that's a good thing because they want to relax.
Yeah,
So it
for some
helps the
guys, they
penis-
just
okay.
yeah. I have a number of guys that come in and their scrotum is always in that position. You know, the position that you said, like, so it's always in that position, and for them it's uncomfortable, or just aesthetically, they just doesn't like the way they just don't like the way it looks.
Yeah.
So we will put, you know, Botox in that area, or one of the other like formulas like Dysport or something like that. there.
Scrotox is
I
real.
love that though when the balls get all.
I like the diversity
personally, I'm
balls.
like, oh, and I like
Yeah.
like a
Do
hanging
they
one.
hang low? Do they do the
Yeah, so you got to so when you like on your first date, this is something you have to ask like guys
On
like
your
have they
first
had
date.
Scrotox, right? Because like if you like for it to kind of go up near the penis, then that's not the guy for you that is Scrotox,
Because
right?
it's not as
Or
much
if you want it
movement.
to hang, then that's that
Yeah.
might be, you might want to suggest Scrotox for them.
Yeah. Yeah.
You know?
Or
That's
if
a
you
good
want
point.
the diversity of like, okay, they hang and then when you're or you're super aroused or when you're about to orgasm, right? They like tighten into the body and you could be like, where did your balls go?
Right.
So you're saying
Yeah.
with Scrotox though, they probably don't do a lot of that diversity of movement.
Yeah,
They
there's
kinda
not
do
a
one
lot
thing.
of that.
Yeah.
There's not a lot of, it's mostly relaxed. And
Okay.
so, like I said, for a lot of guys, it's just for aesthetically, they like the way it looks. And if they're having pain, then obviously, if they're having testicular pain, I see a lot of chronic testicular pain. That's another thing that I do. We don't want the scrotum to kind of bunch up in that area because it can cause more discomfort.
Can I ask about this? Wasn't really on our questions, but like, what are the chronic testicular pain? What are the reasons why people are experiencing that? Like, what are the most common reasons?
Yeah, so sometimes it comes out of the blue, right? Sometimes a guy can have what we call a varicocele, which is like varicose veins that you see in people's legs. Sometimes guys can have that in their scrotum.
Oh wow!
Some guys can get it after like any kind of testicular surgery or anything. But oftentimes it's just, you know, it's just like more of a chronic problem that guys get, and we don't often understand why they get it. But we understand how to treat it. Sometimes it's pelvic floor dysfunction. So pelvic floor is when the muscles of the pelvic floor become really tight and spasm, and that can radiate up to the testicle as well.
So I wonder, because sometimes and this is totally my theory, if like tight pants or like tight underwear, or like because and like when I wear tight pants, like your vulva, you can get like chafing and things. I wonder if too much like, and you can tell me, Dr. Gittens is probably like, April, no, no. But like, if like that could, remember in the 80s, dudes wore a lot of tight pants too. If like it could affect like the way your balls are actively like laying or receiving. Yeah.
And be in relaxed phase.
Yeah.
Well, I mean, I see a marketing. I see like a way we can design these jeans where we can get like really just like relax, maybe a hole in the crotch or something like that. That's something we can do.
Almost like a little
This is a market. This is like an opportunity here, right?
This might be someone out there listening. Hey,
a pair of pants, but it has a little like sling for your balls to hang in. But
There you
like
go.
it is adjustable, so you can like loosen them, and they could be low or high, and then they're like just hanging out, having a vacation.
I think that about that
All
when I
the
wear
time.
like a fucking bodysuit. I'm like, why is this not thinking about my outer labia?
Think about my
right
jeans
Yeah.
right now.
Yeah.
Sorry.
So,
Okay.
actually, so, kind of what you said. So if you I mean, if you're wearing your underwear is really tight and your pants are really tight, then that's going to be probably the solution for a lot of guys is to kind of wear maybe boxers or looser fitting pants. But we actually, for the guys that have chronic pain, we do try to have them support their underwear, use supportive underwear, support their testicles, but we don't want them wearing too tight, like underpants or jeans. So
It's like Goldilocks. You want it
So
just
that is
right.
you want it just right.
Yeah.
But that does make sense though. So if someone out there is like, oh, wait, I have had testicular pain. I do wear tight, maybe underwear or tight pants sometimes. Maybe that is affecting my testicular, like a comfort, right? Like I'm comfortable. I just think it is something to think about because I love clothing, but anyway, that's not the reason you're here. You're way too smart to talk about the testicular, like the moose knuckle or the camel toe. That can happen.
Yoga pants.
I know.
Let's bring So let's bring back to the erectile health piece, because that was where our initial intention, although we love balls and we love balls here. And I know our listeners love balls. I love when we talk about balls. But so let's talk about other aspects of erectile health that could affect performance. Like, what are some other things? And I know April kind of hinted at this before. Maybe this was off air, but maybe some things that involve like mental health or stress or depression, right? Like some other things that can affect erections other than blood flow that you're seeing.
Yeah, we throw around like erectile difficulties and erectile dysfunction like it's nothing, like it's just like a common thing. But it really can affect a guy's ego. It can affect how they feel about themselves, how they feel about, their relationship. I mean, it gets really, really deep, when it comes to erectile dysfunction. I mean, there's some stats that show that guys that have erectile difficulties, they have more days off of work, they call in sick more, they have higher rates of depression. I mean, this is a real problem, and so, there are some, mental issues that can go with it, some depression. I have some guys that come in and just, they're working, but they're just say, Doc, I just don't feel like myself. Like, I feel like something's missing. And they're speaking about their erections. So anxiety plays a big role. So, we have something called the fight or flight response. And what happens is you make adrenaline, right? And so all the guys listening out there will know that if they're playing sports and they're in a high adrenaline sport and they try to go to the bathroom and they look at their penis, it's a lot smaller, right? So what's happening there is that adrenaline is coming in and it's actually taking blood flow away from the penis and it's shifting it to areas like your arms and your legs so you can fight or you can run, right? But adrenaline is kind of like it's not a very smart chemical, right? So that same chemical plays a role when guys have problems with intercourse. So you had a bad experience. What happens is you get anxious and the adrenaline starts kicking in and it doesn't know that you want to have sex. It just knows that it's there. And so what it's going to do is it's going to do the exact same thing. It's going to take blood flow away from the penis and it's going to shift it to your arms and your legs. So it's going to make it a lot more difficult for guys to have an erection. So when we talk about like, situational ED or anxiety induced ED, we're really talking about more or less like adrenaline. So that's a big deal, right?
Wow.
And that plays a role, like I said, with depression and everything like that. Guys that have some depression, they're going to have probably more anxiety if their depression is caused by their ED, they're going to have more anxiety when they're going to try to have intercourse again.
It does make sense if you think about that. I never thought about adrenaline in terms of the genitals versus the kind of like flowing through the body parts, like your extremities, like your other extremities, meaning like your arms and your legs when you're playing basketball, like LeBron James getting like, he's raging and then, he's like, wait, I mean, he's probably gonna have to think about his cock when he's like throwing like amazing.
Yeah, his penis is probably pretty small when he's like making.
Yeah, right. I mean, I've never thought about it because I love LeBron.
Or like a bear's coming to attack you. It's not the time to have a boner or like a schlong hanging out. Like
makes sense.
Yeah, you actually think about it. I mean, if we're fighting, the last thing you want to have is somebody to injure your penis, right? And
so, God, yeah. I want it tucked inside of me. I don't have one, but that's what I'd like if I had one.
Exactly. So that's the reason for it. And so, so guys will have we used to call it psychological ED. At least I call it adrenaline mediated erectile dysfunction. So that's where it comes from.
Oh, I'm already learning so much. I love like talking to you about this particular subject. I didn't know you have so many more deviations from what we could talk about. You are like the
I can talk about food. I can talk about food. I like talking about food too. Wine. No, I'm joking.
And
wine and and what about traveling and all these? No, I'm joking.
I thought it was like food and erections. Like what foods give you the best erection?
That for next time. I feel like Dr. Gittens, you're kind of our people already. I can tell. So I want to bring it back to something that we actually have never addressed in the show. And we've talked a lot about prostate health in the show, and we've talked about ED a number of times, and we've never talked about post-prostate cancer therapies. Also, I touched on this in the beginning, bladder cancer, and then the colorectal cancer treatments that people endure, and then they do not have a lot of accessibility with their erectile function, right? They have erectile challenges after these treatments. So in your practice, you do these post-cancer treatments, and people can benefit and regain erectile health on some level. I know you can't guarantee anything, but I'd love for you to talk more about these treatments and what this looks like. And also, that's it, because I don't want to give you too many questions. I do that every time.
I'm like, I got to write these things down.
I know. I'm like, I'm sorry, Dr. Gittens.
So I'm going to go back to like, why did I go into the field, right? Because you asked me, that was the first question. And I kind of gave you a short answer, but the real answer was that, for me, it was like a patient experience, right? It was a guy that when I was a resident, he had just been diagnosed with prostate cancer and he was cancer free. So this is, months after, and my supervising physician said, "You're cancer free." And this is like a big brawny guy, like strong guy, stereotypical, like beat your chest kind of guy, right? And I'm in the room and my attending leaves and the guy starts crying, right? And I'm like, what's going on? Like he just said like you're cured. Like, why are you crying, right? And he just, he really opened up to me and he just said how important his sexual function was. And he was unable to have an erection and be close to his wife in that manner and be intimate. And so that really started my journey in terms of why I I started and trained in this field, is because of that one person. And I still get a little emotional about it today because I can still see it.
Mm-hmm.
And so, prostate cancer is very common. It's one of the most common cancers amongst men. And there's a number of different treatments. There's surgery, there's radiation, there's like seed therapy, there's hormonal therapy, depends on the stage. And unfortunately, many of the treatments, I would say almost the majority of the treatments, unless you're watching it, can cause some erectile difficulties because the nerves that are going to the penis are kind of have to pass by the prostate, right? And so when you have treatment and so when you're destroying those prostate cancer cells or removing the prostate, you're going to have at least a little damage to those nerves, right? And that's going to lead to erectile difficulties. You're also going to have some vascular. So you got a lot of arteries and veins that are kind of going by the prostate as well, and the bladder. So you mentioned the bladder, same thing, that they're kind of right in that area. And because you have some damage to the nerves and to the blood vessels, and that's going to compromise the penis, and you're going to have some erectile difficulties from that, right? And so for those guys, I'm pretty aggressive. So if a guy's coming in he's thinking about radiation, because radiation, it's a number of treatments. If you're thinking about it, it's like 30 treatments over 30 days or something like that. I forgot the total regimen, but it's a lot of treatments. And so we're proactive. So I'm treating those guys before they are going through radiation. During radiation, we're treating them to try to get the best results, right? For guys that have had their prostate removed, we're being proactive before. So we're starting them maybe on a pump or so, or with those radiation guys, we're also using a pump initially, something like the exerciser or something. And then we're being aggressive afterwards. And if it's core wave therapy, or if we're using injections, or if we're using like low doses Cialis or what have you, it depends on the individual. But, so we do have protocols for, bladder cancer and prostate cancer. Mm-hmm. Rectal cancer is very similar. The nerves that affect the penis and are in that area, and the blood vessels are also there as well. So that can also cause some erectile difficulties. But the protocols that we use they're similar, but it's really, for me, it's about getting out ahead. And then it's about treating them aggressively in the beginning, because we do know. So when you look at, for instance, you look at rat studies, right? And you remove like the prostate and everything from a rat, and then you biopsy the penis right after, you see scar tissue. So it's important that we kind of keep that penis really healthy. We get blood flow to that penis so that those penile muscle tissues don't turn into scar, right? So we try to do our best in doing that.
It also sounds like it's important to, which is what you're saying that you do when you're talking about like the bladder, the prostate, the penis, like they're all connected, right? So if you're having health issues in one area, to probably stay on top of the other areas, like the whole being. And we're talking just about like genitals or pelvic floor area, and yet they're all very close to each other and connected and functioning with one another. And so I like that you are already naming a lot of ways that can all be addressed. And so one of our other questions was you already kind of...
I also want to say that it's so interesting that prostates even though it's internal and it's like you can't see it, it's inside, right? The rectum, like it's internal, it's beyond the rectum. But you can't see that, but it causes scar tissue to happen in lab rats, like on the penis. Like that to me is mind blowing. Like that just from having the prostate removed, you can have scar tissue on the penis without even touching the penis. Did I hear that correctly? And I didn't mean to interrupt Amy, but I'm like mind blown by that, like that factor. That's fucking crazy.
All those nerves and those blood vessels are traveling in that way. And when you talk about like colon cancer, it's really like the lower colon cancers that you're talking about, the one that are kind of close to the rectum and close to the prostate. So those are, but if you have like a colon cancer that's a lot higher up, then it probably won't affect your erectile function, at least physically, but it may be emotionally. It can cause some emotional distress, which can cause some ED.
So I have just two last questions, and they're separate from each other, but one.
I had 17 per
17,
question,
perfect.
so that's
Okay.
great. Yeah.
I know. Did I answer all the questions? I'm not sure.
You're crushing. Like we're like interrogating Dr. Gittens here. We're like, wait, we have so many.
So question number one, if I had to have my entire prostate removed and I get it removed, and I'm not experiencing any erectile function like hardness, blood flow, is there a protocol or a way that I can get some? And what would that be? Question number two.
So wait, so going back to that question, so you don't have any erectile function or you have erectile?
I'm not getting any blood flow. My cock is like, no matter what I do, it's if I get
if I'm lucky, prostatectomy and you have no function of your cock at all. Okay.
And if I'm lucky, I can get like a little, look, there's a little something, but it's like not even a softie. Is there anything I can do to get something there? I'll start with that one.
Yeah, there is. I mean, like I said, first we want to start the kind of that rehab program. So to prevent some of the scarring and you can have some decrease in length. And I love like pumps, like pumps are great. So something like the exerciser again. But then, you want to go down. I usually do an ultrasound and see what the blood flow is. And then you can use like injections. You can use, depending on how severe things are, you can use cold wave therapy. And if nothing works after some time, you can use like a penile implant. So those are things so there's definitely hope for everyone. Like a penile implant is almost like success rates are really high. So those are the things that you can use. So you'll be able to get an erection in some way.
So we used to, so the sex shop I own with my mom, which is now online, purepleasureshop.com. We used to have the brick and mortar. And I remember being there in the store working with people when they were coming the cock ring section or the pump section, we would ask them from our education so can you get some blood flow? Because we learned the hard way, meaning not that hard is the wrong word for this, but we learned the inaccurate way, the unfortunate way that if we sold a cock ring or a pump to someone who could not already get some blood flow, they would go home, be very disappointed. And they already needed some blood flow to do, like you need something to work with, like the pumps and the rings. But there's all these other ways to work with that. Like what I'm hearing from you is like you're working from a deeper level to bring the blood flow there, and that could be like implants or things like that. But like to get the blood flow there, and then you can work with these other things. But you need to have some blood there to start with to do like pumps and rings. Question.
So for pumps, the pumps will bring blood flow to the penis because it's like a negative pressure device, and so they'll bring some blood flow to the penis. Will it stay? It probably won't stay. Then that's when you're going to need like a ring. So a ring will allow that blood flow to stay after a pump if you're using it to have sex. But just a ring alone won't work, right? Yeah. And you have to be able to get blood flow to the penis first. And then what the ring does is it occludes the blood flow from leaving. So you place that ring on there. So I hope that answers that one question.
Yes. And so is the exerciser a bathmate product?
The bathmate, right? Exerciser? Is it the same
so
thing?
So it's very similar. The design and everything is very similar, but what they're using is mostly just like exercising. And so
okay, so this is the exerciser, but not the one that you're talking about.
Something different.
It's something different because it says exerciser. That's why I was like,
that's the exerciser. The exerciser.
We have it.
Okay.
We just got it so our partners could try it.
Yeah.
And I'm because we love Bathmate, but like I didn't know. Amy was like, I think this is the same product, and I'm like, oh my god, I think it is, and that's awesome. It's the exerciser. exerciser.
Yes, the
And
exercise. That's it.
yeah, we're showing. We had no idea this.
You're
was
watching
gonna
on
be
YouTube. You can see it's just a box, by the way. We don't have a pump out.
No, we just got these in the mail for our partners
Yeah.
because.
Oh,
So
I have a pump. I can show it to you. You want to
yeah,
pump
yeah.
it?
yes,
Whip out your
yes.
pump.
That's so awesome. We had. I'm serious.
not follow
Here,
the
this is what it looks
stereotypical-
like.
Oh,
Yeah.
see?
Yeah.
Okay.
Oh, I love those.
And do you have to use it
Yeah.
in water, right? Do you have to because
You use it in water.
in water, like in a bathtub?
Oh no, you can do
in a
shower.
bathtub or a shower. You
shower.
can just
Okay.
kind of turn it upside down and you put the water in. You can use it in the shower. Yeah.
Okay.
So it's nice,
So you-
especially it's great to use in the shower because it's like I mean, unless somebody's in the shower with you. But what else do you do in the shower? You're mostly thinking. You soap off, and then why not use a penis pump? At the same time. But also, for guys that have, I love this for guys that have had prostate cancer and they also have some urinary leakage, right? And so for guys that have urinary incontinence, because that's one of the side effects, right? When you use like a pneumatic pump, like it gets messy because water.
You're talking
gets
about the
everywhere.
ones with the
air.
the
Air
actual
with the
like
air,
the
right?
bulb.
So, yeah, with the air.
Right.
So there's different types of pumps. There's pumps that use air to kind of increase like the negative pressure, and there's ones that use water, right? So the good thing about using like a hydro pump like the exerciser is if you have some urinary incontinence like after prostate cancer, then if urine leaks, who cares, right? It's water all around, right? But if you're using a pneumatic pump and you're out and it's like, it gets leakage all over, it's urine everywhere. And so guys don't really like that. So especially for those guys that are leaking, I love this pump for that.
Just seeing people use the exerciser, I've seen
back in the day, like years ago.
Yeah, years ago, because
Yeah.
we go to sex toy trade shows, so we would see demos, and it was generally on like a dildo, but they were using it under a body of water, so it was in a fish tank, and they would use it as a spongy dildo, and they would show how it would work. And so it's not your traditional pump where you're pumping a bunch, right? You're only doing like a couple little bump suction things, and then you'd see the aftermath of it, and it made sense to my brain that using the water, so having your spongy tissue, your erectile tissue, immersed with like surrounded by water with something that's suctioning a little bit, and so that it makes sense that the water in itself would make your tissue even more spongy, just like a sponge in water, versus an air pump, which is a little more on the dry side, right? Like it's just air.
It's like sucking the air out versus like bringing all these water molecules, this H2O.
I want a
Exactly.
spongy wet dick. That sounds great.
But also when you look at like the physiology and the physics behind it, it's actually by having the water in the tube in the exerciser, it's actually more equally distributed throughout than air. So it actually is like a more informed kind of pump, you would say, or more conformed like negative pressure that you get.
Yeah.
That makes so much sense. And I love that you talked about the exerciser and we just got it. Isn't that
It's like got it today.
Yes. It came in the mail today. We've known about the product
and
for
also,
a long time.
just so everyone knows,
And-
Dr. Paul Gittens did not send this to us.
No, this was a complete,
I didn't
but I
send it.
love that. That's sometimes how things work.
Yeah.
And especially in Shameless Sex. So we have to wrap up because I know you're also not in California time and we don't want to take up all of your time because you're a busy human. And thank you for all the work you're doing. But will you please tell folks not only how they can find you and work with you, because you do so much more than just ED stuff. You do folks. Well, you do things for people with all sorts of sexual health and wellness needs. So I'd love to tell our listeners how they can find you, if they can work with you, also your website, and more about Dr. Gittens.
Yeah. I mean, we, like you said, we treat any kind of sexual problem that somebody has. We treat them male or female. And then we have like male infertility. I do like vasectomy reversals and things like that. So microsurgery and everything. So my Rockwell centers, we're in 3 locations currently. We're in New York City in Manhattan. We're in Philadelphia, and we're in Allentown, which is in the Lehigh Valley in Pennsylvania. You can find me at Dr. Gittens on Instagram. Don't laugh on my Instagram. Getting there, it'll get there at some point, but we're present. And our website is rockwellcenters.com with like an S on the center, so rockwellcenters.com.
And people can get the exerciser on your website, I assume, as well.
I don't have it on my website, but you can go to the site, and if they want a discount, they can put Gittens 20 on there,
Okay.
and they can get a discount. From the website.
We'll have this information for everyone. And definitely check out
Show notes, y'all.
all of Dr. Gittens' work, because you are just really, you're helping people. And I haven't reiterated this enough, because your folks reach out to us and I was like, whoa, look at this human, what he's doing. He's an expert. You're an expert, and one of the leading experts in the United States, if not the world, for helping treat people with various sexual health issues. So thank you again for being on Shameless Sex with us, and for honoring Amy and I's sometimes our debauchery with, like, my moose knuckle pants theory slash
good team.
Me, I'm
we love a good
designing those
team.
pants right now as we speak. What are you
I'm
talking?
thinking it's
Oh,
going
let
to
me
make
know.
the big bucks. I think
It's
this is a
gonna-
smart choice.
I love
We're
it.
gonna-
They can be sexy.
We'll
Yeah.
debut it next Christmas. Actually,
Yeah.
it'll be
Oh,
like
I love it.
I'm
Well,
going to buy all my friends. some
me
pants.
Well,
too.
thank you
If
for
there-
having me. It's
Ah.
been a pleasure. Like, it was great, and you guys do such good work. You really do. Anytime you want to reach out to me, just let me know.
you'll be hearing from us. Don't
Yeah.
worry.
When you
Dun,
guys figured
dun,
out
dun.
how to use
that's
Botox as a
that's
birth
threat
control
and
method, let me know.
That's a threat
I'm
for you.
still hanging in there to freeze the sperm in the balls. New version of Scrotox. Birth control for 3 months. Just
Oh,
planting the seed,
there-
FDA.
There we
I
go.
love it.
Oh my God. Okay.
Love it.
We love all of our listeners.
Easily reversible.
Just as much as we
Temporary.
love Amy and I's 10 gentle ways.
I also believe in unicorns, fairies, leprechauns. So.
If you love Shameless Sex and what we do, go ahead and rate us. I invite you. Don't challenge you. I just invite you. It helps more folks find work of Dr. Gittens and people that are changing the world and helping people improve their sex lives, y'all. So please, I invite you to do that. And I also invite you to honor your beautiful self, because we will see you next Tuesday. All right. Ciao for now.